All right, welcome everyone. Today we are going to buckle up for a pretty unique anatomical road trip. We're going to be navigating the major superhighways of the human body, the arteries. Our journey is going to start right at the heart and we'll travel all the way down to the pelvis. We'll explore the main roads, of course, but also some really unexpected detours and even a few dangerously unmarked intersections. So, let's get rolling.
So here's our itinerary, our game plan for the trip. We're going to start on the main drag, the aortic superhighway. Then we'll talk about some common detours in our anatomy, make a stop at the abdomen's power station, and try to navigate the tricky pelvic delta. We'll also cover the body's incredible emergency backroad system and end with something that sounds pretty intense, the crown of death.
Okay, so every good road trip has to start somewhere, right? For us, it begins on the aortic superhighway. This is the main trunk, the interstate from which all the other arterial roads are going to branch off.
So what exactly is the aorta? Well, it's the undisputed king of arteries. It's the big one. It comes directly off the heart, and it's the main pipeline responsible for getting all that fresh, oxygenated blood to literally every single part of your body. Think of it as the Interstate 95 of your circulatory system. Everything connects to it.
As we cruise down the aorta, we're going to pass through 4 distinct regions. Our trip starts at the root, right as we're leaving the heart. From there, we go up through the ascending aorta, then we take this beautiful sweeping curve known as the arch, and finally, we head south through the chest in the descending aorta.
Now, branching off this massive highway is a much smaller but absolutely vital side road, the Artery of Adamkiewicz. You might not have heard of it, but it's a critical blood supply for the spinal cord. Surgeons and radiologists are always on the lookout for its classic hairpin turn on scans. It's like this tiny but totally life-sustaining off-ramp.
But this is where it gets really interesting. What happens when the map you're using, the one in the textbook, doesn't actually match the territory in front of you? Well, in anatomy, that happens all the time. So let's explore some of the most common detours from that standard roadmap.
So get this. Take the aortic arch, for example. The quote-unquote normal anatomy that you see in textbooks, that's only what you find in about 75% of people. That means a full 1 in 4 people have a different branching pattern up there. The most common variation, showing up in about 15% of us, is called the bovine arch.
All right, let's keep heading south on our journey. We're now arriving at a really critical junction. You could call it the power station for all of our abdominal organs. This is the spot where the celiac and mesenteric arteries branch off to power the liver, the stomach, the intestines, the whole shebang.
And if you thought the aortic arch had a lot of variations, oh boy, get a load of this. The classic textbook branching pattern for the celiac axis, the main power line here, is only found in about 60% of people. Let that sink in. That means 4 out of every 10 people you meet have a different anatomical layout in this critical area.
So, because of all this variation, we have to get a couple of terms straight. You'll hear surgeons talk about replaced and accessory arteries. A replaced artery just means that vessel is coming from a totally different place than you'd expect. An accessory artery, on the other hand, is an extra one. You have the normal one, plus a bonus vessel coming from somewhere else. And knowing the difference is just absolutely critical.
Which, brings us to a pretty blunt but fair question. Why should we care? Why do surgeons and radiologists get so obsessed over these tiny little anatomical detours?
Well, because it's literally a matter of life and death. That's why. An unexpected artery can totally change the game plan for a liver transplant or a tumor removal. Not knowing it's there can put a major blood vessel at risk during something as routine as gallbladder surgery. And yeah, for any of you medical students watching, you can bet your bottom dollar this is going to be on the test.
All right, our journey continues further south, down into the pelvis. Here, that big aorta finally splits into the iliac arteries. The internal iliac artery, in particular, becomes this really complex, almost delta-like network of branching vessels that supply all the pelvic organs.
It gets messy down here.
So, to remember the branches of just one part of this artery, the posterior division, medical students have come up with let's just say, a very memorable, slightly provocative, but super effective mnemonic.
And here's how it works. It's actually pretty clever. The I, the L, and the S in that phrase stand for the iliolumbar, the lateral sacral, and the superior gluteal arteries. And just like that, you've memorized the posterior division. It's a simple little trick to remember a really complex map.
Okay, but what happens if one of these main roads gets completely blocked? Like a huge traffic jam from disease or an injury? Well, the body has this brilliant backup plan.
a whole network of emergency backroads. We call it collateral circulation. One of the most important and well-known of these backroads, especially in the abdomen, is called the arc of Riolan. It's like a natural bypass, creating this crucial link between two of the main arteries that supply the intestines, the superior mesenteric artery, or SMA, and the inferior mesenteric artery, the IMA.
So how does this amazing little detour work? Well, let's say the main route to the IMA is blocked. No problem. The body reroutes the blood flow. It goes from the SMA into a branch called the middle colic, then it crosses over through that arc of Riolan, connects to the left colic artery, and boom, blood flow is restored. It's an incredible, life-saving piece of natural engineering.
And that brings us to the final stop on our trip. We're arriving at an intersection with a truly dramatic name, one that every surgeon respects and fears, the crown of death. So what is this thing? What exactly is this ominous-sounding anatomical landmark?
The Corona Mortis, which is Latin for crown of death, is another one of these anatomical variants. It's a blood vessel that connects two major pelvic arteries, and it just so happens to run directly over the front of the pelvic bone.
And this is why it gets that scary name. Its location is just terrible. It's incredibly vulnerable. It can get torn during a bad pelvic fracture or accidentally cut during surgery. And when this thing starts to bleed, the bleeding is massive and it is notoriously difficult to get under control. And if you need a number to really understand the stakes here, listen to this. Some estimates suggest this one anatomical variation is involved in as many as 6 to 8% of all deaths from major pelvic trauma. Knowing this dangerous road might exist can literally be the difference between life and death.
And that pretty much brings our road trip to a close. What have we learned? That the body's vascular map isn't some fixed chart, it's this dynamic, living landscape full of common variations, rare detours, and hidden backroads. And it leaves us with one final thought to chew on. Knowing the map is one thing, but what does it really mean for medicine when the map itself can change so dramatically from person to person?